We turn next here at 6 to our ongoing investigative series, Patient No More. We're listening to your concerns about needing health care that your insurance denied.
And you're about to meet a woman paralyzed from the chest down, fighting for the equipment that she needs just to live every day.
It makes you angry, and sometimes, you know, the insurance companies, you just get frustrated because you do it over and over and it never changes.
She reached out to our consumer investigative reporter Susan El Khoury, and after her health insurance denied claims for the medical gear she needs.
Sometimes all you need is a little perspective.
Life's too good to waste it.
Karen Evanoski isn't letting what's happened in her life
Get the straps hooked up here.
I'm a quadriplegic. And then he slides me over to the bed.
get in her way.
I just feel so grateful that I'm able to get up every day.
While she's used to needing help,
So you want to lean up.
she doesn't think she should have to live without the basics, getting in and out of bed
So it's very dangerous. I could fall.
and taking a shower.
And in the past 16 years, I haven't had a shower. I've always had a bed bath. My insurance has denied me the shower chair twice.
She says Medicaid should cover the gear she needs, but those claims were denied.
I'm a human. I'm not a drag on the system. You know, I'm a person and I deserve to be cared for the way that I should and have the things that I need and not have to fight every day.
Evanoski has been on Medicaid for almost 3 decades, ever since she was a passenger in a car crash.
Flipped in a truck and I landed upside down on the back of my head and neck, and it paralyzed me from the chest down.
After the accident, Medicaid paid for a ceiling lift,
Here we go.
but from the straps that hold her in to the machine itself,
Kind of sounds like a straining.
it's seen better days.
It won't charge correctly, so I'm having to have my aide push it up to the wall, get on a ladder, stick it to the charger.
Then there's the shower situation.
And it's hard when every day you see it and you can't have it.
Evanoski moved into this house last year and renovated the bathroom to include a roll-in shower, but to use it, she needs a shower chair.
I'm always having to have somebody bathe me in a bed, and it never feels like you're really clean.
Her insurance is through Sunshine Health, which is contracted by the state of Florida to cover Medicaid patients. Evanoski says her doctor requested a new lift and a shower chair, but Sunshine Health denied the claims, saying they're not medically necessary.
It makes you just feel like you don't matter.
She says she appealed, but months later, still no success.
Why is this a hard thing to approve? It seems silly to me. I can tell you there's days where you just cry because you're tired.
Sunshine Health chose to not do an interview. They sent a statement saying, in part, the company's top priority is to support the health and well-being of every person we serve. They never acknowledged Evanoski's case.
Folks don't know that they have legal rights.
Attorney Katie DeBreer is the legal director for the Florida Health Justice Project, a nonprofit that advocates for access to health care and provides free legal services to fight appeals.
You get the initial denial and then you have to appeal that internally with the plan, which requires certain specific steps one has to follow. And then if you get that second layer of denial, you can go up to the state and ask for an administrative hearing. But that can be very confusing to people.
She says there's another part of this picture. Private companies contracted by the state of Florida to provide Medicaid get paid a fixed rate for each patient.
So it's not dependent on how much care is doled out, and what that can do is create an incentive within the Medicaid managed care plan to deny care, because then they keep more money.
If you ask Evanoski, she's the one now paying the price. Days after we talked, she sent this video. Her lift stopped working. Evanoski, who lives on Social Security disability, said she had to buy a used manual lift, but it doesn't work the same and puts her in a dangerous position.
I've always been a fighter.
Fighting for the life she almost lost, and now fighting for what she needs to keep living.
I'm hoping this will have them do something finally and do something that will benefit me for the quality of my life.
Susan joins us now in the studio. These pieces have been so eye-opening because these are people. They're not statistics or numbers. These are human beings.
Yeah, our heart goes out to her. What an incredibly sad situation she's in.
Yeah, it's really hard to imagine just being in that spot, not being able to take a shower, or just get in and out of bed on your own. One of the things that she did do, though, is she did go to the state agency that will investigate Medicaid complaints, and she filed a report with them. And I got off the phone with her just hours ago, and she said that she has getting some action there. She heard back they are looking into it. But ultimately, though, there's no resolution here. She doesn't have any answers, and she doesn't have that medical gear that she really does need.
Yeah, I thought it was interesting too that Sunshine Company said that they really care about the mental well-being of their patients. Well, then give her what she needs so her mental well-being is okay and she can finally take that shower and not in her bed. The other thing I wanted to touch on is just last week, I know you shared a story about a woman who went through a procedure that the insurance approved. It was $400,000, and then she got a bill for it, even though they approved it, and they weren't going to pay it, but then you got that bill down to zero, which is really incredible to show when you stick up for people, sometimes they really do listen.
Results.
Yeah, that persistence matters. And I mean, she had been calling on her own. She'd been trying to handle it. She'd been going between her health insurance company, her provider, just trying to figure out, who do I go to here? Why is this bill, coming to me when I thought it was for an approved treatment? She showed us the letter. It said it was approved. Her provider even got the letter as well saying it was approved. And that just shows how much persistent that you have to be. And when you can get it in front of the right person, her case within a day of us calling was resolved. So big relief for her, but obviously shows just all of the steps that are involved here and some of the pain that people are having to deal with in the process.
Yeah.
Right.
Sometimes you need an advocate on your side.
Yeah, and I hope that maybe they'll listen to this latest woman too, because our heart goes out to her. Thank you.
Susan, thank you.